Hey everyone, welcome back to my channel. I'm Sheila G, the PAC, and today's video is all about cysts, specifically the most common cysts that we see on the skin. Before getting started, don't forget to like, comment, and subscribe to my channel for all things dermatology. And if you want a completely free downloadable chart that breaks down the details of all the cysts that we talk about today, you can get that in the link provided down below in the description box. Now, let's get started. The first group of cysts that we'll discuss come from different regions of either the epidermis, the hair follicle, or the oil glands. So let's talk about the most common type of cyst first, which are epidermal inclusion cysts. These cysts form when skin cells don't shed appropriately, and so they get trapped underneath the skin and then they accumulate. They're most commonly caused by either ingrown hairs or blocked oil glands or even minor trauma to the skin. A membranous sac then forms around this collection of keratin, and we also see a small opening at the top of the cyst that looks like a little blackhead called a central punctum. Now these cysts are pretty round, firm, and normally flesh colored, and they can range from a few millimeters to several centimeters in size. The material that is expressed from these cysts is typically kind of white, cheesy, and not so great smelling. Epidermal inclusion cysts are usually painless, but if that sac ruptures even slightly, the cysts can become very red, swollen, and painful, and they may even become infected and start to drain on their own. When there is a very inflamed inclusion cyst, we opt for an incision and drainage to relieve the pressure and drain a lot of that cystic material and pus. And we also start the patient on a course of antibiotics, so either doxycycline because of its anti-inflammatory effects, or we may choose Bactrim or cephalexin. Now, when these cysts are not inflamed or symptomatic, they don't necessarily require removal, but a lot of patients prefer to have them out anyway. And so the only way to completely remove these cysts is to take out that sac entirely. And so depending on the size of the cyst, we may do a little punch excision, or we can do an elliptical versus slit excision to fully take out that sac and then close it up with stitches. If any little piece of that sac is left behind in the skin, it can come back. And then we have milia cysts, which are very common, and these are tiny cysts that are also filled with keratin, and these are most commonly seen on the face, especially around the eyes. These can be seen in adults and can even be seen temporarily in newborns. Another way that these can come up is post-trauma to the skin. So for example, they can appear along a surgical incision scar. Although milia cysts are similar to inclusion cysts in that they form from dead skin cells that get trapped underneath the skin, milia are very superficial and they do not have a central punctum. They look like little white pearls on the skin and can be very hard to pop on your own. So we don't recommend that, but we do recommend careful extraction. And also topical retinoids can help treat them and also prevent them. The next cyst type is a pilar cyst. Pilar cysts are again somewhat similar to inclusion cysts in that they contain keratin from trapped skin cells, and they also have an outer membrane. But pilar cysts are actually derived from the outer root sheath of the hair follicle, and this outer root sheath surrounds and protects the hair shaft. Because they originate here, pilar cysts tend to be more firm and have a thicker cyst wall, and they also don't have a central punctum as with inclusion cysts. Because these originate from the hair follicle, they're very common on the scalp. And in a lot of cases, a patient that has a pilar cyst has had multiple pilar cysts. Now these can become inflamed and sometimes tender, but they rarely become infected. And the best and most definitive treatment for these again is a surgical excision. And these tend to come out more often intact because that material is more firm. So they tend to just pop out like a pearl. Next are steatocystomas, which are cysts that originate from the sebaceous glands, specifically the sebaceous duct, which connects the oil gland to the hair follicle, and these are a lot less common. Now these can be seen as singular lesions, but more commonly appear as multiple mobile cysts, and we call that condition steatocystoma multiplex. These cysts are firm, dome-shaped, and often appear in clusters, typically on the chest, the trunk, or the arms, and are more common in younger adolescent patients. And these are filled with a very oily, greasy, yellow material. Although rare, sometimes steatocystomas can be associated with certain hereditary conditions. But the best way to treat these is either with extractions with the removal of that sac, with topical retinoids, or in severe cases, isotretinoin. Next are eruptive vellus hair cysts, and these can look very similar to steatocystomas, but these originate from vellus hairs, which are the very fine, barely visible kind of peach fuzz that covers most of the body. And these cysts are filled with a combination of vellus hairs that are trapped, dead keratin, as well as oil. Similarly to steatocystomas, these cysts are small, dome-shaped, sometimes flesh-colored or gray in color, and often form in clusters, usually again on the chest, the back, and sometimes even the face, and can occur in younger patients, but also adults. These can be extracted, treated with topical retinoids, or with certain lasers such as a CO2 laser. So now let's go over some glandular cysts that are either fluid-filled or semi-fluid filled, starting with digital mucus cysts or myxoid cysts. And these are unique because these arise from the fluid that's within the distal interphalangeal joints of the fingers or the toes. So within our joint capsules, we have synovial fluid, which reduces friction and allows for smooth, pain-free movement. Digital mucus cysts form when that synovial fluid leaks from the joint capsule into the surrounding tissue. And when that synovial fluid leaks into the skin or the surrounding tissue, the body tries to kind of wall it off or seal it off, and then it reacts to the tissue, and then the material or the fluid becomes a little bit more gelatinous. So these cysts are solitary, round, sometimes flesh-colored or translucent, and can feel more firm or a little bit fluctuant. When punctured with a small needle, a clear jelly-like material is expressed, and that's actually one of our standard treatments. However, these often require repeated needle punctures just because they tend to come back. But other options include steroid injections, the application of steroid tape, or there are other surgical options too, but we typically leave that to either orthopedic surgery or hand surgery. Last but not least are eccrine hydrocystomas, which form from a blocked eccrine sweat gland and lead to the retention of sweat. These are most commonly seen around the eyelids, but can also be seen in other places of the face and the neck, and we see them more often in hot, humid environments when sweating is increased. Now these again are small, firm cysts that have either like a clear or almost bluish appearance. These can also be punctured and drained similarly to digital mucus cysts, but we can also treat these with electrodesiccation or with certain types of lasers. So there you have it, the most common cysts that we see in dermatology. Again, please feel free to check out that link provided down below in the description to grab your free cyst chart. Now, when you provide your email address, you'll also start receiving emails from me with exclusive and detailed skincare information and tips about different skin conditions. Thank you guys so much for watching, and of course, don't forget to like, comment, and subscribe to my channel for all things dermatology. I'll see you next time.